Okay, welcome back. Welcome to Laksha Academy YouTube channel. The use of alcohol during the adolescence may also have long-term effects. Okay, use of alcohol during adolescence. Okay, now you are a adolescent. You are an adolescent because people between 12 to 18 years are called adolescents. Okay, those who are studying intermediate, those students are in this age group. Okay, you have to be very careful. The use of alcohol, drug, and alcohol during adolescence may have a long-term effects. What are they? It could lead to heavy drinking in the adulthood. Okay, after adolescence, what comes adult? Okay, you reach adulthood. Okay, during that adulthood, okay, it may lead to when they started drinking during the adolescence. Okay, when they come to adulthood, at that time it becomes a heavy drinking habit. The chronic use of drugs and alcohol may damage nervous system as well as liver. It is very, very, very important. It was asked in previous exam. Okay, it is the liver is the largest gland in our body which performs many vital functions. Okay, more than 100 functions it carries out. Urea is formed there. Okay, next one, albumins are formed there, globulins are formed there, some hormones are formed there, some vitamins are stored there, some many proteins are synthesized in the liver. Liver is a storehouse and it is in our body. It is the first check post of our body. Whenever toxins enter in our body, those toxins are detoxified by the liver. Okay, liver performs many functions, not one. The use of drugs and alcohols during pregnancy. Okay, during pregnancy, it is known to adversely affect the fetus. The fetal growth is adversely affected. You can see here, this is the normal liver. Liver is properly. Next, what is the doping? Okay, another misuse of drugs is what certain sports persons do to enhance that. What is important? This term doping. Another misuse of drugs. Sometimes drugs are misused by sports person. Okay, what certain persons do to enhance their performance. Okay, they misuse narcotic analgesics. Okay, you can see the what happens if the mother takes alcohol that leads to fetal alcoholic syndrome FAS. Earlier we learned acquired disease and congenital disease. Acquired disease and congenital. Okay, congenital means okay the children get through by birth. Okay, by the time of birth, okay they acquire that from the parents. If mother takes alcohol pregnancy, the baby fetal alcoholic syndrome develops small head. You can observe here epicanthal folds here, low nasal bridge here, short nose, underdeveloped jaw. Okay, these all are the symptoms of fetal alcoholic syndrome. Okay, that's why mother should not use alcohol during pregnancy. They misuse the misuse. Okay, this is a sports person. They misuse narcotic analgesics and anabolic steroids. Anabolic steroids they use to build their muscles and diuretics. Okay, and certain hormones. Okay, in the sports to enhance their muscle strength and to build their muscles. Okay, you might have seen the people who participate in WWF. They are very stout and they are very muscular. The body has a lot of muscles build up. Muscle build up is there. Okay, those people use some steroids, anabolic steroids. Anabolic androgenic steroids are used by testosterone, which are synthesized artificial. They take them to build muscles. Okay, bulk. Also okay, a lot bulk to promote aggressiveness. Okay, they fight in the WWF. You might have seen okay, women or men they fight aggressively, and as a result, Okay, increase athletic performance. They can run. Those who are okay athletes who are participating in running, okay, as they are using narcotic analgesics, okay, which is a sedative as well as a painkiller. They don't feel any pain. They go on running without any pain. You can see here narcotic analgesics are painkillers. It can be delirium and drowsiness. They may cause drowsiness, and these are morphine, heroin, codeine, methadone, pethidine, and fentanyl. Okay, these are some of the narcotic analgesics. These all are important. In book two are given. These two, three are also very important. They were asked in previous exam. Okay, these are painkillers and they suppress the pain. That's why these drugs are used by performers, sports person to suppress the pain and enable them to carry on even with an injury. They don't know. For example, there is a sports person. Okay, there is a runner. Okay, whose okay knee is injured. Okay, when there is an injury in the okay uh, knee, they feel pain. But as they are using narcotic analgesics, they don't feel pain. They go on running. And you can see some articles, we frequently see some articles related to doping. Okay, young, the menace of young athletes are taking to doping. Okay, you can read this article. Okay, drug administer. What do you mean by doping? Meaning of the word doping. Administer means inject this food. Administer drugs to race horse. Sometimes the drugs are given to the race horse and greyhounds, and also to an athlete in order to inhibit or enhance sporting performance. The horse was doped before the race. Some people giving to the horses also, and okay, they run very quickly. A drug taken by an athlete to improve performance. Okay, dope. Okay, from Dutch word DOP, dope. Okay, it violates the ethical principles. Generally, they should not use the drugs, but they are violating the rules here. So, anabolic steroids in female. What is the effect of side effects of use of anabolic steroids in female? Okay, you might have seen some of the women who participate in WWF. Okay, they build lot of muscles. They use these anabolic steroids. Okay, masculinization features like males. Okay, generally masculinization is more in males than girls because of testosterone. More testosterone in male. Okay, in females also testosterone is there produced by adrenal gland, but in small amounts. But these people, these women, okay, who are for these females who are participating in WWF and other game, okay, they use anabolic steroid. Therefore, they look like males. Their masculization, development of muscles, okay, nothing but like males. Next, increase aggressive. These women are very aggressive. Like generally, aggressiveness is more in men, and mood swings. There will be mood swings and depression, abnormal menstrual cycles. Menstrual cycle become irregular. And next one, excessive hair growth on the face and body in these women, enlargement of clitoris. Clitoris, you will learn later, which is similar to penis of the male. Clitoris is present in the, it's one of the part in the female external genitalia, which is homologous to penis of males, and deepening of voice, change in voice. And you can see the anatomy of a steroid user, male and female who are using steroids. You can see many changes taking place in the body. You can observe here enlarged clitoris and altered libido, sexual desires change, infertility, menstrual irregularities, increased hair growth, more hair growth like male men. Okay, you can okay read these all. So, okay, okay, enlarged vocal cords size increased, decreased breast size. Okay, these are the some of the changes that take place here. And damaged kidneys and liver, you can observe here. Heart disease and large muscles, you can observe in both. Okay, this is the Okay, because of use of steroids, their anatomy structure changes, body structure changes both in females as well as in males. Okay, we discussed here masculization in females, increased aggressiveness, mood swings, depression, abnormal menstrual cycle, excessive hair growth on the face as well as in the body, enlargement of clitoris, one of the external genitalia in female, and deepening of voice. And okay, these are the some of the things we observe in females. Next, what about males? In males, it includes acne, development of motel pimples, increased aggressiveness, mood swings, depression. You can observe here reduced size of testicles in males. And next one, decreased sperm production. And next one, potential for kidney and liver dysfunction. And next one, breast enlargement in males. Okay, in females, breast decreases, premature baldness. The baldness, enlargement of prostate gland is one of the learned in 10th class. Also in males, there are three accessory glands are there. Okay, male sex accessory glands are there. Those are called prostate gland and seminal vesicles and Cowper's gland or bulbourethral gland. Enlargement of prostate gland we can observe there. Things decrease sperm count, abnormal sperm shape also okay, and shrinking of testicles. Okay, there we discussed that point. Male and female, the effects may be permanent with the prolonged use. Okay, in the adolescent, male or female, several severe facial and premature closure of growth circles of long bones, and which may result in growth also decrease, stunted growth. Okay, prevention and control. Okay, I will cover this is the last part in this lesson in the next